linkages. Oh, thank you, Liz, for hitting the recording. And you'll get to hear from Dr. Weist and some studies he's done about and how to integrate mental health into schools. Some logistics for the webinar today. You can go to pbis.org and get a full recording of the webinar after we're done. It'll probably take a couple of days actually to get it up there. So if you missed anything or you want to hear it again, we'll have it posted there. Please keep yourself on mute. And it says here until breakout groups. I have some bad news. We won't be doing the breakout groups at 4 o'clock today. Just the logistics got past us and we had a few people out sick. So we're not going to be able to do the breakout groups. Please use the chat feature if you have any questions or you need technical assistance. I'm here. We have some PBIS Coalition members here to help you. Dr. Weist will stop at various parts of the webinar to answer any questions as well. Also, please be respectful to the presenter, to each other. This isn't a presentation format, so there will be some interaction, but when you're not interacting, keep yourself on mute so we don't have any talking over or anything like that. Honor other people's attention and take time to listen. So excellent. And follow us online. So we're going to be doing some shout outs today on Facebook, Twitter, or you can go to pbisca.org to contact us. Our email's up there at pbisca.org, and follow us and tweet, and also follow Twitter because we're making a lot of great announcements about upcoming events or Tuesday tips on Twitter as well. So our agenda, we're going to do introductions. You'll hear a little bit more about the PBIS Coalition. We're hopefully going to do an entry poll, but again, our logistics are a little short today, so we may skip that. And we're going to talk about integrated mental health into schools. As I said, we'll have a recap of the last network meeting and then a closing and thank you, but we won't be able to do breakout groups, unfortunately. So the California PBIS Coalition is here to help support you all across the state, support the evidence-based implementation of PBIS across California using multi-tiered systems framework. We follow the national blueprint model for professional development. So wherever you are coming to us from in California, there's a regional technical assistance center near you to help you support your implementation of PBIS or integrated mental health. A few of my colleagues are on the call. I think I have pictures of them right here. So you'll see Cami Murphy and others are here today. So if you need TA or you need support, go to pbisca.org. You'll see our email addresses, hover over your portion of the state, and you can get connected to a technical assistance center near you. The welcome poll, I think we're going to skip this because of some technology challenges. Boy, you have all faced those over the last 2 years, so thank you for your understanding. But I think we'll skip the welcome poll today. And I'll introduce Dr. Weist. So Dr. Weist is here to us today from the University of South Carolina, so USC. And I believe, Mark, you're the first USC, right?
Yes, 1801.
1801, so he's the real USC. No offense to any University of Southern California people, but Dr. Weist, prior to going to University of South Carolina, did his undergrad work at Duke University and then followed up and became a professor at University of South Carolina. In 1995 with colleagues, he helped to form the University of Maryland National Center on Mental Health in Schools. And it's been around for 26 years. So if you have not checked out the University of Maryland website, they have fantastic resources there. They do a conference every year. Well, now back that we're in person, you can go to their conferences and get lots of good resources. So he is also a partner to the National Center on PBIS. He's a researcher, author, accomplished implementer of school-based mental health and PBIS. He leads the Southeastern School Behavioral Health Community and is lead-in or co-authoring a number of federally funded studies on strategies to improve school-based mental health. So if you look at him today, you would think Mark's like 200 years old with all these accomplishments. I don't know how he fit this breadth and depth of work into his career, but he's quite accomplished. One thing I do want to say about Mark, and I was telling somebody this earlier, Mark is just a genuinely generous and kind and collaborative person. So I've been stuck and I've emailed Mark. He'll return my emails and help us here in California from all the way across the country. It's 3 hours later there right now. And here he is, at what, 6 o'clock in South Carolina, helping us do this webinar. So without any further ado, I think we'll turn it over to Mark, and I'll stop sharing my screen here, and we'll let you share your screen, Mark. Excellent.
Thanks very much, Mike, and back at you. I really appreciate the collaboration with you. And I was fortunate to be in Sacramento for the conference last September. It was fabulous, really great group of folks. It was great to be in person. I think we had 900 back then.
I did.
Just one correction. I was a really bad high school student, so I couldn't have made it into Duke University. But thanks, Mike. I did do my internship there after I approved my scholarship, but that wouldn't have happened at the undergrad level. Yeah, I'm in this for a long time now. This first year as a professor, and a lot has happened. Also, to a lot of collaborators. I'm not going to name each of the folks here, but it's a community of practice, and we all support one another and steal each other's slides and all of that. If you were in either of the two sessions that I presented in September, you'll find some of the same information here, with apologies for that. But and I'll stop every 6 or 7 slides or so to see if there are questions or comments in the chat. This is what we'll cover: mental health in schools. This context that we're in that has been very challenging for everyone. We'll talk about this conceptual framework that's been guiding our work for about 15 years, the Interconnected System Framework for School Mental Health and PBIS. We'll present some resources on the ISF, talk about moving toward holistic approaches, present some study findings, and then some networking and resources. So I was at the University of Maryland, and I went there in 1991. Ironically, I had no background working in the schools. I was trying to be a pediatric psychologist, so that's why I went to Duke for my internship and my dissertation on coping among children and adolescents with diabetes. And then I found myself in Maryland, in Baltimore, working in the schools in a fairly innovative program that was through the school-based health centers there in Baltimore. And what we found is, as we opened up the school-based health center, we identified a huge amount of unmet mental health need. And it created just really strong advocacy for expanding mental health in schools, which is a win for the schools in that, they're receiving greater resources to address mental health issues in students, and a win for the mental health system because it's much more relevant, because we were also learning back then that there are so many barriers that prevent youth and families from going to mental health centers: transportation, stigma, stress, finances, wait lists, et cetera. So it's really a win-win, and this thing began to take off in the early 90s, this mental health in schools movement. And then we're really fortunate to be one of 2 national centers to receive funding in 1995 from the Health Resources and Services Administration, the one at University of Maryland, and there's one at UCLA. as well. And at that time, there were also 5 states that were funded to build infrastructure support for school mental health. You can see them listed there. And probably the reason I came to South Carolina in 2010 was the strong infrastructure the state had built for mental health in schools. And we'll present some South Carolina examples today. This is me back in 1996. We were originally the Center for School Mental Health Assistance. And then for a while, we were the Center for School Mental Health Analysis and Action, and then the Center for School Mental Health, and now the National Center for School Mental Health. But as Mike mentioned, the center is in its 26th year and going very strong, directed by Sharon Hoover and Nancy Lever. And you can go on schoolmentalhealth.org and find a lot of resources and things that are going on at the center now. Early on, we were participating in this multiple level research and practice and policy and trying to link those 3 realms together. And the research was beginning to show some positive benefits back in the 90s, including tremendously improved access to mental health when you move it to a more natural environment such as schools, improved early identification and intervention for students' needs, especially for students with the internalizing issues with depression and anxiety, trauma-related. We do a lot better identifying those issues in schools than in other settings. And often youth will need to act out, honestly, to get into a other community system. It's always important to frame this in relation to the school system. Our goal is to reduce and remove barriers to learning and help achieve outcomes that people care about. And this is an agenda that's relevant to any citizen, because it's about helping our students learn, do well in school, matriculate, graduate, and go on and become positive citizens. So this is a really important agenda in any community. And I know there's just a huge amount of opportunity in California. But the caveat is when done well. Child and adolescent mental health is a fairly new field. Really, it began in the 80s. As an example, there were a lot of adultomorphizing things happening back in the early development of child and adolescent mental health, where we took principles and constructs for adults and just applied them directly to children. And there's still a lot of things that happen in the space that aren't so strong. And we'll cover some of those things now, but that's a big caveat. You don't want to just move mental health into a school building if it's poor quality mental health services. And that does happen. We've seen tremendous growth in school mental health around the nation. At the center that we mentioned, that you can find at schoolmentalhealth.org, has information on the growth of school mental health around the nation. But a problem is that many of the programs lack an implementation structure. So a school district or a school will develop a relationship with a community provider, whether that's part of the public system or private system, and then have that provider come into the building to add to the services that are already provided by school employed mental health professionals, such as counselors, social workers, psychologists, behavioral experts. But often that would happen in and this still happens today, happening in California, where it's a co-located, where you'll have a clinician from some mental health center in the building a Wednesday, seeing students, but no one really knows what they're doing. And they're not in any way integrated into the building. They're not participating in teams. That's what we want to avoid. We want to avoid that co-located strategy. And it's especially important now to avoid that strategy, given the tremendous need that we're seeing. So some of us, in spite of a lot of time at home, have had more than one job. I've had my core job, but also this other job around interfacing with the pandemic. And we've had all these different phases. I guess we're still in some phase of it. But this was an international webinar that I participated in March of 21. And it was just so compelling, the quotes from participants in that webinar about the impact on young people. And we believe now we have data to indicate that children and youth and young adults have been the most impacted by the pandemic and all the other issues that are going on. You can read some of the quotes: enormous impact, degrading mental health, youth are crumbling, crushed, doing my best to not fall off a cliff, lack of trust in leaders, significant fear of failure. And we're also seeing evidence of significantly increased social isolation, loneliness, depression, anxiety. Admissions for self-harm in many communities are more than double what they were prior to the pandemic. I'm privileged to have a connection to Hawaii, and I believe Mike was just in Hawaii. And when I was in West Hawaii around spring of 21, had the chance to interact with students virtually, learning of their work. But this is a great group, Malama Mental Health, and some of the things that they stated, that people weren't really acknowledging how the pandemic was impacting them, really complaining a lot about virtual learning. It's difficult, it's boring, it's stressful. It contributes also to lost boundaries. So children are home, often without the private space to do schooling, lack of breaks, lack of personal time, feeling really busy, lost mental health, physical health lost, increased insecurities, people saying we're here from you, but that they believing that wasn't really true. And you can check them out on that website. Some of the other observations that, the literature has really begun to document the benefits of in-person versus virtual schooling. That's a report by UNESCO. And that's also a challenge and sort of a catch-22, because many of our most vulnerable youth were most likely to be in virtual learning, yet they had the greatest need for in-person and the in-person support. We've seen really tremendous variability in school status and inequities based on zip code or school district. A fair amount of arbitrary and in some cases biased decision-making. So for example, when I was in Hawaii, schools had the ability to bring some students back, but how were they making decisions on which students to welcome back? And it was clear that there were some biases in those decisions. We know that we've lost a good number of students. And then there's a tremendous outreach need to find them and help and get them back to be connected to school. To see this pattern of students will disappear, reappear, disappear again. And then again, many of them falling through the cracks. Students who fail in virtual learning are highly vulnerable to not continue their education. So we're seeing students failing in virtual learning, not coming back to school. And again, the outreach press is and will be very high. At the conference we just held in Myrtle Beach that I'm going to tell you more about, a big theme was we're looking at probably about at least 3 years of really, really difficult work. That's related to what we know about traumatic experiences. For example, after Hurricane Katrina, people in Maslow's hierarchy were really focused on basic needs, food, survival, shelter. The mental health needs really began to escalate 4, 5, 6 months after the tragedy. And we're seeing that now. We're really seeing an escalation in the mental health needs. On the other hand, there are some positives where we are seeing transparency, people coming forward and indicating that they have mental health challenges. Probably more than 40% of youth have challenges right now, which is up from about 25%. We're seeing an increased urgency to do something about it. We're seeing schools prioritize mental health. We're seeing tremendously increased support for school mental health, which creates a lot of work to do this the right way. We're seeing growing interdisciplinary and cross-system collaboration because the systems are recognizing they cannot do this work alone. The disciplines are recognizing they can't do it alone. And we're also seeing breakthroughs in virtual learning and telemental health. And I've been in some discussions recently around, so telemental health works with some, not so well with other students. For example, it does seem to work well with adolescents, maybe with internalizing issues. But we don't really have the algorithms for determining when we use tele versus in-person, or the hybrid models, such as this many in-person sessions followed by this number of tele to promote the sustaining of gains made, or the hybrid models around you're in a room with a student, but you have mom on the video. There's all kind of opportunities with this technology, but it feels like we're really early in using it. As part of the PBIS, I'm a partner on the PBIS National Center, and we played a background role on this report from the US Department of Education that came out in the fall of 2021, which I would recommend as a really valuable document providing guidance as schools and districts were beginning to reopen and return and have students return to school. And in that report, there's some of these conclusions, and I'll stop for questions or anything in the chat after this slide. But one of the most important conclusions is that the multi-tiered system of support is foundational, and that without a strong MTSS, which is, promotion, prevention, tier 1, early intervention, tier 2, more intensive treatment, tier 3, and all of these core features, teams, database decision-making, selecting, implementing, refining evidence-based practices, coaching, progress monitoring, layering programs together across tiers, alignment, et cetera. All of those processes are absolutely essential as we have these very significant elevated mental health needs among students now. Without an MTSS and also with all the money that's out there for schools and districts to purchase things, the risk is things are just going to get purchased that aren't going to be helpful and aren't going to get implemented. And it'll be a hodgepodge of ineffective programming. And in my opinion, and I think this opinion is shared by others, PBIS is the best articulation of a well-done multi-tiered system of support. We also know there are very significant workforce needs. We've also seen a lot of the workforce leave the field related to vicarious trauma. I can't deal with your issues, I've got my own now. Related to, they now can work virtually, maybe wear a nice shirt, but still in their pajama pants. So it's easier. So there's a lot of these virtual mental health private for-profit companies springing up and offering folks a fair amount of money to quit their other jobs to stay home and do virtual therapy. So we have tremendous workforce needs. We're down more than 250 school mental health counselors in South Carolina right now. And we've always been way understaffed for the school employed mental health professionals, psychologists, counselors, social workers, nurses. The ratios are not anywhere near where they should be. So this also points to kind of the notion of giving mental health away, mental health literacy for all, and also moving in a direction of these MTSS specialists or folks that are bachelor's trained, not professionals per se, but folks that can come in and do a lot of work in the MTSS. Some places are calling them community mental health liaisons. I'll pause here to see if there are any comments or questions in the chat.
We don't have any yet, but
Okay.
I'd like to tell you an experience that I have in the form of a question. So earlier this week, in talking to some folks, they said, well, I get what you're talking about, Mike. We need a system, we need MTSS, but we don't have time for that. Like, we have a problem now. And, that juxtapose, like, yeah, but how effective? And so I feel like some of the folks on the call today maybe getting the same feedback or question, like, I don't have time to do it. I have this crisis. How would you address that?
Oh my goodness, Mike, that's a tough question. I think I would respond honestly that you're going to be sprinting around, you're going to be highly stressed. You may help a few students, but you're going to be far less able to help many more students in the months to come. And we can move fairly quickly to implement some of these key elements. Doesn't have to be perfect, but please slow down, please pause, implement at both ends. Have counselors who are trained to work with the intensive needs and intensive needs, but at the same time, work on the core features of your MTSS. Develop an MTSS team, have the right people on it. Analyze where you are at tier 1, tier 2, tier 3. Utilize resources like through the PBIS Center, through your center, through the School Mental Health Center. But please slow down and focus on building this thing because it's going to be absolutely essential for you.
Thank you.
What a tough but also really important question. Here are some other bigger themes. The need for mental health literacy. Mental health literacy in the United States, in other nations, it's more advanced, especially Canada. So there's a pretty strong literature that when people are knowledgeable about mental health, it's often therapeutic. Like I might have, let's say, post-traumatic stress disorder, and I don't even know it. But when I learn about the symptoms of PTSD, that can be therapeutic for me. Secondly, when you learn about mental health, it reduces stigma, and stigma is the #1 barrier to seeking mental health. And third, when you learn about mental health, it promotes help seeking. And we need for be reaching out for help now when they're struggling. Also wellness, and we'll come back to wellness. That's been one of my frustrations, that there hasn't been more of a federal push around wellness, around some of the supplements we know that are helpful around exercise, nutrition, relaxation, nature walks. We really need these things. It's been really important for me and my family in what we've gone through in the pandemic to be focusing on wellness, but also resilience. We're all showing resilience. We've all been through a very tremendously difficult time, but we're putting one foot in front of the other. We're learning to be strong. We're showing some grit, resilience, and resurrecting the literature on resilience because it's just so relevant now. Another theme is we've had this tremendous academic slide. And so, every year we have this when students leave in May and return in August or June and return in September. They've lost some learning in those few months. Now we have, and it's called the learning slide. Now we have a learning slide that might be 2 years long. So there are very significant academic deficits. So the school leaders may just want to push academic. That's important. But what we're finding is that that's not where folks are, where the students, the families, the teachers, they're on the social behavioral side. We're still really struggling to cope with what we've been through. We also know we really need to invest in data now to be able to understand what's going on in our buildings, what's going on in terms of needs, what's going on in terms of assets. How do we maximize our assets to best address the needs? And most schools don't have the best data management system. So really now is the time to reinvest in those data management systems. It's just a little bit more on mental health literacy. I've worked with Stan Kuchar and Yifan Wei out of Dalhousie University, and they created this program called The Guide. You can find it on teenmentalhealth.org. It's a really great program. You can see some of the emphasis, how to maintain good mental health, understand disorders, decrease stigma, and how to seek help. We have this integrated into a study now, and I think it's moving the needle on student outcomes. It's actually pretty popular among the school staff. They resonate with this as they're implementing this curriculum with what's going on in the pandemic. This is another really good one. Mike and I, before we started, we're talking about the mental health technology transfer centers, which we have around the nation. We have one Southeast that's based in Emory. And this program, Classroom-Wise, was developed by the MHTTC and the National Center for School Mental Health. And I'd really highly recommend it as a mental health literacy program. So think about mental health literacy, something that we should be doing in all schools now, something that we're doing universally as we're all contending with mental health issues. Wellness strategies, I mentioned some of them. Stress management, really, really critical. Reframing, and when I'm in a stressful situation, I can do this. So cognitive coping, I can get through this. But then after going through the stressful situation, talking to a friend or loved one about what you went through, so getting social support. And there's actually data that when you do those two things together, it actually helps your immune system. When you reframe stress and then talk through what you've been through, it actually helps your immune system. Obviously, the cell phone and social media use, even before the pandemic, I think many of us were just struggling with the amount of information flying at us, and we're always operating at 110 miles an hour. trying to integrate information from all these diverse sources, it's really difficult to do, and it causes a lot of stress. So getting away from media, getting away from phone, doing less, moving more slowly, sleep, mindfulness. I've been doing something called slow mornings, where you just get up and move slowly and focus on one thing at a time, and be very purposeful in each thing. Like, okay, now I'm going to make the coffee, and just take your time and focus on that. Being in nature, and you see some of these other ones: exercise, nutrition, cognitive coping. The Malama Mental Health Group has been focusing on wellness too, and you can see they have some of the same things, but the ones with the asterisk are things that they recommend also: practice meditation, open up, laugh more, stay hydrated, avoid multitasking. What a good one. Practice forgiveness, try something new, use your breath, give thanks. Wellness, really important. And if we had more time, I'd love to hear about, as you have all these really big opportunities in California, how you're integrating wellness into the work. I'll pause here to see if there's anything in the chat or any comments or questions.
It doesn't look like we have any questions in the chat, but I am creating links to all these sites you're featuring, Mark. So.
Okay, appreciate that, Mike. Thank you. So when I was working in the schools in Baltimore in the 90s and 2000s, and I was in a very large high school there with a lot of need, and an innovative school mental health program. And we began to hear about PBIS, and some of them were even in the building, but it was total parallel play. They were them, we were us. We didn't even overlap at all. And so around 2009, I began to work with Lucille Eber and Susan Barrett, and I know Susan's in your state, around connecting these two things together, one system versus two. So there was a white paper that came out in 2009 where we talked about this interconnected system framework, a systematic strategy to connect education and mental health systems together in an efficient manner, guided by the right stakeholders and including people who have authority. And it's really complementary, right? So PBIS often has strength in tier 1, but may lack strength in tier 2 and tier 3. And there may be issues like PBIS often doesn't do very well with internalizing issues. School mental health doesn't really have any strength in tier 1. So it can capitalize on the infrastructure of PBIS and then help to add resources and supports to build out a full continuum of tier 1, 2, and 3 effective programming. So we're deliberately using the multi-tiered system of support and all the knowledge from PBIS to develop one system focusing on improving student social, emotional, behavioral, and academic functioning. I'm talking today more about the social, emotional, behavioral side. And that ideally, we have one system. And there is a need for some level of standardization. One of the things I see with federalism, states' rights, local control, is, I'll use the word hodgepodge again. You just see a bunch of different things happening in a state that aren't connected together, or even in a district, county, and you see a lot of variability between states. But we need to move toward consistency, coherence. So in our state, South Carolina, we've been working to improve vertical collaboration, so state to district to building, and that at each of those levels, horizontal, interdisciplinary collaboration, and having things look kind of the same at all the levels, and really paying attention to the levels of scale, and really significantly enhancing the family and youth voice in this work, because the family and youth voice is very minimal, it's tokenistic. There's an ebook on the pbis.org website that we did on 2017 around family engagement, and we've got to really totally change the paradigm. I'd also recommend you check out a group called the Family School Community Alliance, doing work to change that paradigm. So again, some of these core features that I know are playing out in the work there that should be constantly emphasized: effective teams. I'm going to come back to this. Database decision-making really, and again, that's back to having infrastructure for utilizing. That's also an alignment issue. If you have a large complex data system that's not being utilized in a large complex data system, sometimes we need to move toward more simple systems that are going to actually be used. How are you going to select evidence-based practices? How do you define them? Because there are actually a lot of things implemented in schools that are not evidence-based. There are a lot of things that are sold to schools by private companies that are not evidence-based. So that's a big one, how you choose evidence-based practices that you actually can implement. So another lens is feasibility, achievability of these practices. How do we reduce the gap between knowing a student needs help and actually helping a student? That's back to screening. I'm going to come back to that, and really doing screening more consistently and doing it well. How do we not just launch something and then expect it's going to work, but really do the progress monitoring well, both for how the interventions are being delivered, but also for how the students are responding to them, and then being able to nimbly make some changes when our progress monitoring data indicate that things are going off the rails. Coaching is absolutely huge. There's a big literature in implementation science on coaching. The National Implementation Research Network is another resource, but typically we don't do coaching very well, where we have one coach assigned for 10 schools and it's just insufficient. So what's the level of coaching that's necessary? In our research, we believe it's one coach for 4 schools max to enable an adequate level of support. So some of our advantages, we're moving away from the co-located model to a single system. We're trying to align relevant initiatives. We've got family and youth really engaged, ideally as leaders, co-creating the educational environment. We've got one team. I'm going to come back to this. That's another thing to think about. Often if you go into a building and you map the teams that are occurring, you're going to find there are a bunch of teams. They're not functioning very well. They start late, they end early, they don't have agenda items, they don't include the right folks. And it's maybe the same tired people that are on 3 or 4 teams. Mapping the teams, moving ideally toward one strong MTSS team focusing on social behavioral is something that I would recommend. And then you have again, across system, schools aren't doing this on their own. I see a movement. Schools will say, well, we have trouble connecting the mental health system. We're going to just do this by ourselves. Well, you're giving up all the knowledge, all the resources of the mental health system. You're often giving up afternoon and evening hours. You're giving up crisis response. You're giving up summer support. You're giving up access to a range of other funding mechanisms if schools say we're going to just do this solo. So there should be a partnership with the mental health system and other systems. I'm going to come back to that. But if you have mental health clinicians in the building, they shouldn't be viewed as outsiders. We shouldn't call them outsiders. They should be viewed as if they're employed by the school. They should have a school email. They should have a badge. They should be on all the teams. The memorandum of agreement should specify that they can participate in any discussion versus being excused from meetings because of FERPA or HIPAA. And we could talk at length about that issue. This is the first ebook that we did. Lucille Eber calls it a monograph, but it's not because it's got a bunch of chapters. This has been viewed or downloaded about 50,000 times. We did this in 2013. And then this is a newer one in 2020 that Lucille led, and really great. And it just focuses on a lot of pragmatic issues, tools, and resources and steps for effective implementation. So I would highly recommend this ebook. I'll pause and see if there are any comments or questions, Mike or Liz.
No questions so far.
All right.
We're saving them up for the end.
Okay. And we can go a little bit past 4-year time, or?
Yeah, no problem.
Okay. So this is really one of the fundamental things too that we need to work on significantly, and that is this district community leadership team, which would be interfacing between your state resources, other resources, national resources, things happening in other counties, to reach down to your buildings and really support high quality work in the building and you can in the buildings, and you can see the folks that should be involved. It should be a broad group and include some of the other youth serving systems, child welfare, juvenile justice, disabilities, primary care, and meeting regularly, at least quarterly, available for ad hoc phone calls and emails, and really driving the work so that we're having diverse stakeholders really driving the work. And the collective intellect is smarter, right? So the more we can enable people from these diverse backgrounds to have a voice in the work, the higher the quality of the work is going to be. You can see some other groups here: Voc Rehab, universities, faith community, business community, that will bring a lot to the table when you involve them. So, a way to look at it again is the DCLT is mediating in a collaborative role between resources and things at state, district, other districts, national levels, down to buildings, but at the same time, tracking what's happening in buildings and getting support down to them, but also getting the best practices happening in buildings up and out so that other schools can benefit from them. I think I went backward, sorry. This is a resource. I'm not going to get into it in any detail, but from the 2020 ISF book on strategies for installing a district community leadership. And this may go back to your question, Mike, about they say we just respond to the crisis. We don't have time for an MTSS. Another key step would probably be get your DCLT up and running, get the community engaged, get the voices involved, get the group problem solving in place, prioritize that meeting and these processes because they're going to be absolutely critical. But I think you'll find in the book, in this chapter on installing in DCLT, very pragmatic guidance doing the work. Something also really important, like imagine we do this often in a school building where we'll take a triangle and we'll map what's happening at tier 1, tier 2, tier 3. Are these things working? What's not working? What do we need to replace? What's duplicative with something else? We can do that same kind of process at a district level, right? What are the initiatives that are happening now for youth? What are their commonalities? How relevant are they to our MTSS? Can we make connections with these initiatives? Can we promote more coherence in the way these initiatives are playing out in our community? Just a really important set of processes. And here you have just an example. I believe you all will have this PowerPoint so that you can look at some of these examples. And then, it's really all about alignment, alignment of the initiatives that we're implementing in a school building and also those that we're implementing at a district level. And who's going to do that? Well, an executive level team, 4 or 5 people, education, mental health, families, researchers, a policy leader, an executive level team that's meeting regularly and helping the DCLT gain strength, helping to point toward valued outcomes, helping to identify core system features, moving toward alignment across multiple dimensions. So the school teams, if I had to pick, and we're working for the PBIS Center and developing a document on effective school teams over the summer, I think it's maybe the #1 quality indicator for the work. That if you go into a building and you find teams that are not meeting or they don't make sense or they're duplicative, you're not going to have a very strong MTSS. You're not going to have the change agents implementing that strong MTSS. So we should have consistent and systematic meetings. We should use strategies so that the meetings are consistent and systematic, like the team initiated problem solving program that you'll find on pbis.org. Metacognition, thinking about our thinking. We should be identifying when our processes are working and when they're not. And when they're not working, we make corrections. We need to have the right members. Ideally, principals are on these teams, or at least attending every other. If assistant principals should be on them. You can see the other folks. Families and students should be on them. We shouldn't let confidentiality be a cop-out because we can start the team meeting at tier 1, then tier 2, then data system practices at tier 3. before we get to talking about individual students. And at that point, families and students can be excused. But we really need to make dramatic progress in family and youth leadership on these teams. Again, mapping them will be really critical. And in my view, one team. Instead of 3 separate teams, tier 1, 2, and 3, which just creates a recipe for incoherence, in my opinion. One strong MTSS team focusing on social, emotional, behavioral, but having team leaders at each of the tiers. And a couple team leaders at each of the tiers are doing work outside of the team meetings, for example, to strengthen climate enhancement at tier 1. And again, the community staff are on these teams as if they were employed by the school. So looking at this one, it underscores I'm sorry, my son's coming in the room. The simplistic, here's the problem, let's come up with a solution, to the steps that should be involved in effective problem solving. And again, I'm not going to go through all of them, but you can see that. And then here's another resource for installing the ISF at the level of a school building. So many of you use the tiered Fidelity inventory or a tool like that for assessing the quality of your MTSS, and we use those tools as well. And the TFI is actually now being updated, and with a new version coming out soon for schools and districts that want to use it in a demonstration project. But we also developed this interconnected systems implementation inventory, reflecting the key facets of the ISF. It's a fairly brief measure, and you can see items for tier 1, tier 2, and tier 3. And you can see a fair number of the items actually reflect teaming. So do the team members collaborate? Do they include education, mental health system representatives, families, and students? Are there active opportunities for participation and collaboration?
So Mark, I had a couple of questions, just going back some slides.
Okay.
The importance of the district community leadership team and then the school site team as the key critical features, right, for this work.
Yes.
So we can make comprehensive, integrated decisions with our community partners. Now in California, there's a $4 billion investment happening through the Child Youth Behavioral Incentive Project, through the Department of Healthcare Services. All of that is headed towards schools now. And I love that the state's making this investment, but I worry that when you push this investment against incoherent systems, there could be a waste of resources, particularly for our rural communities. Can you say a little more about involving these community-based resources in schools?
Yeah.
If I don't take you too far off track.
No. I think you're right that there would be a tremendous risk of wasted resources if you're going to throw money at an incoherent system. So I could cite the example of Montana, for example, some years ago, where in order for schools and districts to access enhanced funding for mental health services, they had to demonstrate strength in PBIS. I think similar, so that you could have gated allocation of funding, that in order to receive phase 1 of funding, you have to do these things, like have a strong DCLT in place. You need to map the MTSS in all the buildings in the district. You need to do needs assessment and resource map to identify strengths and weaknesses in the district. And then once you've done those things, you can access phase 1 of funding, and then go from there. Connect funding to quality indicators for the work, because you're right, there's a real big risk of a lot of wasted resources.
So for our colleagues on the call today, these grants and initiatives are coming your way soon, like in the next 6 months. maybe in preparation for that, we could take some of the tools that you're learning about and start readiness, right? So really look at a systems approach. So when the grants come out, if you show up with a systems approach, you might be more competitive, which is great. But what I'm hearing Mark say is you'll be far more successful actually doing this work in a school site in your community. So
Right.
thank you, Mark.
Yeah, readiness. And I would cite my colleague Abe Wandersman, and you could look at his Getting to Outcomes framework, which is all about building readiness for initiatives to actually make an impact. And I could talk more about it. We're also, this notion of moving toward holistic, which includes wellness. So not just social, emotional, behavioral, and academic, but also health. That's the Queen of Sheba, by the way. So I'm doing some work with people from exercise science and cognitive development, and it's blowing my mind. I mean, it's really holistic. Like, for example, how critical motor development is for children, especially young children, but really for children, adolescents, and adults, that if you have problems with your motor functioning, you're going to have other problems. You're going to have problems with social functioning. You may have problems with occupational functioning. For young children, motor problems equate directly with learning problems. But often we don't have the systems in place to assess how students are doing in the motor area. And students may be identified as having disabilities when actually they just have not had anybody helping them with their motor development. So we really need to move toward a more holistic approach, but we're far from it. Cognitive, for example, in schools usually is associated with achievement. We're not thinking about cognitive fluidity, emotion regulation, self-control, problem solving, aspects of cognitive functioning that are really, really important. And think about motor. Do we have motor reflected on our MTSS teams? Do we have the people involved with motor, the physical education people on our MTSS teams? Often not. And I think that that's a glaring omission. Just briefly, in terms of screening, and this has always been semi-controversial, but has gotten a little bit more controversial, it seems like. If you're not going to screen systematically for emotional behavioral challenges in students, you're going to not find a lot of them. So this is a study where we identified, when we implemented a systematic screener, we identified 18.4% more students in need. And half of those students that we identified had serious needs. So here are students out there struggling, no one knows, and no one's reaching out to help them. So systematic screening, really important. And the needs, think about, are in a continuum. At the top these are the students that have a lot of problems, maybe top 3 to 5%. They're going to probably have chronic problems. And then at the bottom, this would be, it should be AB, by the way. A boy, let's say, with some anxiety, but higher adaptive behavior, doing fairly well. But it's a continuum all the way from the significant to the low level. And it's fluid with, except for the top, students moving up and down on the continuum. So how do we fluidly match our programming to this fluid movement of student needs versus just having static, and definitely avoid this. He's the tier 3 child. We definitely want to avoid approaches like that. I've gone to school meetings, and in the tier 3 discussion, there's a student who's doing really well, but he's in the discussion. Why is he in the discussion? Well, he was suspended 2 years ago, and he's still in that tier 3 discussion. So this is a study I mentioned, Mike mentioned. It was a randomized controlled trial funded by the National Institute of Justice, 24 schools, 12 in 2 districts near Charleston, near Gainesville, Florida. 3 conditions: PBIS only, the second PBIS plus school mental health, where we just drop the clinicians in the building and watch the parallel play happen. And then the interconnected systems framework, where they're trained and coached in all the things that we're talking about. And here are some findings, and we have the first major paper under review for publication. In the ISF schools, we found school administration more involved with the test team, more administrators and clinical staff in team meetings, more discussion of school-wide issues and actual improvement of tier 1 programming, more students proactively referred for tier 2 and tier 3 intervention, more students actually receiving those interventions, and increasing interventions over time for youth of color. So some equity advantages here. We also saw reduced in-school suspensions, office discipline referrals, and reduced out-of-school suspension and ODRs for youth of color. So another equity advantage. We have other papers that we're looking at related to climate, student social emotional behavioral functioning, and academic functioning. And there are 4 other major studies going on that connect to the ISF right now. This is another one of them called Project Rise, where we're implementing the ISF in Jacksonville schools, but also implementing equity-related enhancements, database decision-making, teacher wellness and stress reduction, because we know that when staff are not well, they're more likely to make biased decisions, addressing biased teachers and students, and then Kent McIntosh as a consultant, identifying our vulnerable decision-making points and neutralizing routines, such as when, when people are tired in crowded environments, the end of the semester, when there's big school events, identify when there's more likely to be discipline and then strategies to neutralize those situations. Just gonna move to wrap it up and maybe have a little Q&A here at the end, but just some resources. So we've been mentioning the National Center for School Mental Health throughout the talk. Their conference is virtual in the fall. You can see the dates. We're excited the National PBIS Leadership Forum will be in person in Chicago. It's a great meeting. I am so personally excited that, we're back to in person. Lucille Eber and team do a phenomenal job. And I've been mentioning community as a practice. Joanne Cashman, when I met her in 2000, just revolutionized our work, where the notion is that any systematic thing that you do rests on top of the relationships. And we should be really purposeful about the relationships. Because if we're not, the systematic thing is not going to work. And also, I've been a part of a lot of initiatives. They come and go. But if you focus on relationships, you're creating fertile ground for the next thing. And so leading by convening, great resource they published in 2014. How do we create the convening environment where we can move a group of people along from discussion to dialogue to collaboration to policy change and resource enhancement? Really, really important resource. And so there are a lot of these communities out there that are focusing on, supporting one another. I mentioned before, the collective intellect is smarter. Moving toward enhanced collaboration across disciplines and definitely systems, including the youth and the families. And we interact with all of these networks, all of them doing great work. And you can see ours there at the bottom. So we're very purposefully interacting with the 12 Southeastern states. This is South Carolina centric. We're in South Carolina, but we have state advisors from the 11 other states working with us, convened. We have a statewide project funded by the State Office of Special Education Services called Reliance of South Carolina. We have Realm 1, our multi-realm strategy, kind of matching a multi-tier approach in school. We just had our conference in Myrtle Beach. It was phenomenal. We had more than 500 people in person and more than 300 virtual. And you can see the title, Behavioral Health in a Critical Time of Need, Opportunity, and Recovery. You can see Tim Lewis was one of our keynotes. We always have a keynote from the PBIS world. Tim did a great job. Ray Patterson from the school mental health world did a tremendous job. And we had Hayden Hurst, Family Foundation represented, Kathy Hurst, Hayden Hurst's mom. Hayden's a professional athlete who went to USC, RUSC, who has had a lot of mental health challenges. And they have a foundation now that focuses on youth mental health and veteran mental health, just really impressive. We do a lot at Realm 2, where we have a website, a resource repository, a YouTube channel that has many of our sessions that we've done recorded. We have information on COVID-19, a calendar of events. We have formal webinars and then informal ones, mini skills-based one, caregiver corner, outlet for praise, basking in the spotlight. Then we're working more intensively with districts, right now 9 districts in South Carolina, providing them with more on-the-ground support, including a high leverage practices manual, which you all are welcome to use. I'm not sure you can access the link to that very well. But in a follow-up, Mike, if you had trouble with that link, I can send you the link to this manual, which is meant to be just very user-friendly, trying to do all the things that, not all the things, but many of the things that I've talked about today in a really user-friendly, fairly brief document that we're continuously updating.
If you send that out to me, Mark, I can get it to the people who registered for today's webinar.
Yes. And then this is our next meeting. I know you might not be so motivated given your beautiful beaches in California to join us next year, but Mike has already said he's coming. So we're excited. Ken McIntosh will be one of the keynotes. So with that, I'll close and go Gamecocks. By the way, we did win the women's national basketball championship.
Excellent.
Just pointing that out.
Any questions for Mark? You can post it in the chat or take yourself off mute. We will switch over to our screen here. Any other questions for Mark?
I have a question. We are in Salinas. We have a really proactive district that has invested a lot of in PBIS and mental health wellness centers. We have social workers with partner with community members for behavioral health and other substance abuse, etc. But still, our schools are huge. 2,600 students in a high school. So it's for us, it's kind of scary to, even though we have a team, it's a small team. I know, I understand the big need of having a very strong tier 1 team, and of course the whole school being involved. But we're scared of the screening because we don't know if we're going to open a can of worms, and we don't have enough staff to support that. So this is our biggest challenge right now. We have everything in place, but we don't have enough staff, like nobody has in the schools. And then my second question is, in high school, some teachers are really they want to have academic success. They want gear into, okay, we need to pass those tests and get it into college stuff. But sometimes it's kind of hard for us to voice that they need to be part of us, and that we need their support. So how can you help us to address that with the students? Our district is going to make it not optional, because some of the staff think that it's optional to be PBIS of tier 1. And our district, with our advisory committee from the district, we asked them to the district to have a video or recorded lesson for all the schools to make it more like, okay, this is not optional, this is everybody, you should be doing it. But what advice would you do for teachers to get more buy-in?
Sure. So for the first, in terms of avoiding screening because of worrying about the magnitude of the need, I think that it has to be, again, a cross-system initiative, right? It can't just be this one school doing the screening and dealing with the aftermath on its own, because you will uncover a significant need. So it could be, for example, pulling staff from other schools, pulling staff from your community mental health, and then engaging in a collaborative effort so that you're able to follow up on the results of the screen. Because what's the point of screening if you're not going to be able to follow up with it? And that's been one of the major impediments, is folks are afraid that they don't have enough resources. I think we have to go down the road because all these people are out there suffering and we don't even know about it. Also, to get the family organizations involved in this, to get groups like the Federation of Families for Children's Mental Health, the National Alliance on Mental Illness involved. The more the families are involved, the more the legislators will take it seriously. And so the other advantage and reason for screening is when you do the screening, then you have more data for advocacy for capacity building. With regard to your second around teachers' reticence, they want to focus on their academics, and I understand that. But I think it's always back to this notion of, especially if you have a well-done program, work with us in our program, And what we're going to do is we're going to remove and reduce barriers to learning, and we're going to make it easier for you to be in your classroom teaching the classes that you want to teach. That's a simple answer to a challenging question, I know, but once teachers buy in and see the benefits, they often are on board and can become your champions. And that would be another angle, would be to identify those teacher champions who really are on board, and spread the word, spread their word to help them influence the others that are feeling more reticent about it. Anyway, thank you for your questions.
Thank you, Mark. There's another question from Tara Crampton, if you have just a few more minutes. Tara, are you still here? Okay. Yeah.
I am. Hello, Mark. I work here at the Monterey County Office of Education in California, and we currently have a Mental Health Student Services Act grant that we wrote with behavioral health for the Interconnected Systems Framework. And it includes 7 districts and 21 school sites. As you were speaking about measuring income or outcomes, I'm sorry, not income, outcomes, we do give the ISF as part of that grant. And we give it yearly. This was our first year of the grant, but I'm interested in how to further measure outcomes as opposed to comparing scores ISF year by year. One of our sites decided to give the DSFI this year instead of the district capacity assessment, but I just am curious what you're using, or is it something that you created to measure outcomes or the effectiveness of Interconnected Systems Framework?
Yeah, so the ISF measure was really intended to measure elements of the Interconnected Systems Framework at the level of a school building. And it would be a proximal measure, right? So you could do more distal measures, such as changes in school climate, changes in student discipline. Obviously, we want to see ISF implementation moving the needle on other school and student outcomes. But I think this is really back to the importance of your district community leadership team, because there are a fair number of tools that are available and very helpful. So for example, there's now the state system fidelity or inventory, the district system fidelity inventory, the TFI, right? So you could have a whole suite of measures with, and again, back to the right data infrastructure at the building level, but also at the district level. So imagine you have your DCLT choosing measures purposefully, measures that are shown to have good psychometrics and actually be responsive to change. And then ideally the guidance to roll that out consistently throughout the district versus having these schools doing this and these schools doing this. With the latter, we have the problem of we don't have any comparability, right? Because people aren't using the same metrics. But I think it's a really great question. I would go back to your district community leadership team. Of course, your PBIS leaders can and should play a role. So in your state, Susan Barrett, Kent McIntosh could be helping guide those discussions around measure selection. I appreciate the question.
Thank you so much. I don't see any other questions. Are there any final questions? I want to let Mark go. It's 7:10 in South Carolina. Okay, well, with that, a big round of applause or clicks for Mark. Thank you so much. You can come and see Mark in person in October. He'll be here October 5th at the PBIS, California PBIS conference, doing one of our pre-conference sessions. And then we'll have a number of sessions on interconnected systems framework and mental health in schools. In fact, our welcome address is going to be from the director of the Child Youth Behavioral Incentive Program at the state. So come join us. Mark, you're getting lots of props in the chat. Before anyone else leaves, you could go to that link at the bottom of the PowerPoint, take a picture of it. You can go to it later. Please give us some feedback for the Coaches Network. We would like to continue these and really gear the work towards you. Any closing comments, Mark?
It's just a privilege to work with you all. You have a tremendous opportunity. Appreciate your leadership, Mike. Best wishes for the next phase, and I look forward to seeing you guys in October.
Thank you. Thank you, everyone. I'm going to hang out for a few minutes and leave this open. So if you want to ask me any questions, I'll be here. Otherwise, we appreciate you coming, and we'll see you at the conference. Thank you. Any other questions from anybody? I see some of my people on the call still.
Just hanging out with you, Mike.
Well, thank you for keeping me company.
Well, didn't want you to be alone.
It's raining outside too.
Is it really?
Yeah. Yeah, it was raining.
Did you guys want to pause or stop the recording?
Yeah, I think, Liz, can you